Hello, everybody. Nice to see you again. It's me, Ben Calder, for the Bowen Therapy Professional Association, the BTPA. And have I got an interesting one for you today? I'm here talking with 30-year veteran of Bowen technique, Mitchel Mosher, who is based out in Charlotte, North Carolina. So one of our American practitioners, a student of Milton Albrecht, author of Bowen Therapy, a Complete Practitioner's Guide, and who also uses Craniosacral Therapy, allergy technique, Asher work, MSTR, psychological clearance, life enhancement, all sorts of stuff. So we're going to be talking about the four wheels of the body. We're going to be talking about feet and all sorts of other stuff through Mitchel's incredible career over the last 30 years. So I hope you really enjoy this one. But before we get into the interview, hit that subscribe button, like and share our interviews, help us to spread the word of Bowen technique around the world, and let's help bring this as one of the best complementary therapies into the lives of more people. So without further ado, here we go, Mitchel Mosher. So, Mitchel, thank you so much for joining me here today on this BTPA, Bowen Therapy Professional Association discussion about Bowen technique. Thank you.
Thank you for inviting me. It's a pleasure to be here. It's an honor, and I'm excited to share with the audience some of my insights to Bowen therapy and some other things that are related, if I
Yeah.
can. Yeah.
Brilliant. And that's exactly what we want. And, it's a real honor for us to have you as well on the podcast, celebrating 30 years of being a Bowen practitioner and everything else you've become in that time this year, which is a pretty serious milestone. But before we get too deep into that, I'd like, just for anybody that hasn't come across your work before, maybe doesn't know so much about your role in Bowen technique over the last 30 years, how did you get into all of this? What led you into this place?
Well, the direct channel was through my 12-year history of low back pain, and I had chased all of the natural health options that I could. I went to my medical doctor and orthopedics and physical therapy, and I didn't want to pursue neurosurgery. And a patient was telling me about her foot one afternoon, and I said, "That sounds like your sciatic nerve is involved. Maybe you do any low back problems?" And she said, "No." She said, "I had those fixed 2 years ago." And I said, "How'd you get them fixed?" And she said, "Well, I had Bowen treatment." And I said, "What kind of bone treatment?" She said, "No, not bone, Bowen." And I said, "What's that?" So she told me a little bit about it, and that piqued my curiosity. And I ended up getting a treatment from my guru, mentor, teacher, Milton Albrecht. And he was a funny fellow, and I call him a California redneck. And he didn't really explain the procedure or the process to me at all. Just wanted to know where I hurt, and I said the lower back, right hand side around the sacroiliac area. And he said, "Oh, cool, lay on that bed table with your feet on the pillow and your butt in the air, and I'll fix you." And I said, "Okay." So I laid on the table with my head down, and he started randomly flipping my muscles as we do. And I'm thinking, this is nuts. What's he doing? And he skips from my back to the back of my legs, and then he gets my shoulders and neck, and then he turns me over. And when he did it, the adductor magnus in the pelvis procedure, I thought he'd hit the ceiling. It hurt so bad, and it was kind of good hurt. It tickled and hurt at the same time. And he left the room for the pause, the break. And my hands started to sweat this Caro syrupy kind of yuck. It was not perspiration. It was like stickum, slimy. And my feet were doing the same thing, although I didn't touch my feet, but I was touching my hands like this. And he walked into the room and he saw me touching my hands. So he tapped my hand with his fingers and says, "That toxin's coming out." I said, "What kind of toxins?" He says, "Don't smell, must be lactic acid." So I didn't think about that for much longer. And he got me off the table and pain free for the first time in 12 years. And it was a done deal. I could feel it. I could sense it. My whole body would just change. And so over the next couple of weeks, my hammer toes on my left foot restless legs and nocturnal cramping all resolved in my legs and feet. And I said, I got to learn how to do this. So I called him up and I said, you're practicing podiatry without a license. You straighten out my hammer toes. He said, I need to do that all the time. And I said, well, you teach me how to do this leg procedures because I was not licensed to do necks and shoulders and all the rest of the body, but I would like to learn how to do the legs. He said, oh, come on, we have a workshop in January of 1995, and that's where we got turned on to it. And interestingly, I've never had a back pain since. I've got some aches and pains because I've had arthritis, so I'm slouched a little bit because I sprained my right ankle when I was 12 years old. And that started the chain of events. The whole right side, my right kidney, my right hip, sacroiliac, my right shoulder drops, my TMJ was out. When Milton did the pelvis procedure and fixed my back, he also straightened up my bite. Everything was on the right side because I sprained my ankle. And that sprain of the ankle, since I learned McLaughlin's scar release technique, the sprains, strains, and the fractures, they all heal with scar tissue. Different forms: bone, calcium, periosteum, tendon sheath, ligament, soft tissue, collagen forms in the area to heal the wound, or hydroxyapatite and bone. And but it's all the same. The scar is a scar is a scar. And that ankle with just a little bit of scar tissue limits just a little bit of motion. And that little restriction of motions changes your angle and your base of gait and your leg length and your pelvic tilt and your shoulder tilt. And they're taking your TMJ. And I finally figured all that out as the years went by with doing Bowen therapy on my podiatry patients. And I realized early on that every podiatry patient needs Bowen therapy, almost. Because if they've lived long enough, they do. Or if they're younger, they do because they've got compensatory problems elsewhere in their body or pain elsewhere in their body because of their foot issue. And the feet are the foundation. You got to get the feet balanced and everything in order to get everything else in line. But also, I discovered that the reason I couldn't get everybody's feet fixed when I was a podiatrist with using Western medicine and interventional conventional medicine and surgery, it was because the feet are caused by problems upstairs. And if the problem is upstairs and you're treating downstairs, the problem's still there upstairs. And so I came to realize that. And I then became a self-proclaimed the world's only holistic podiatrist. I started dealing with the whole body. I started dealing with, actually, I practiced medicine without a license because I had patients coming to me with headaches and earaches and imbalance and digestive issues and bedwetting of boys and all. And that's not something that a podiatrist normally treats. And I didn't treat those things. I just gave people treatments for their posture and relaxation, stress reduction. Those things went away. That's spontaneous remission. I didn't have anything to do with it. The body healed itself. And so I stayed out of trouble with the medical community, but for 14 years before I retired, I had about a third of my practice was outside of the podiatry scope of practice. And then I learned a lot of things. Patrick Russell, I think is how to pronounce his name, came up to me at an advanced seminar one time and he introduced himself and he said, "You're Dr. Mosher, you're a podiatrist." And I said, "Yeah, I'm a podiatrist." He said, "Oh, I've been working with a group of podiatrists and physical therapists and chiropractors in the UK and Europe, and they call themselves posturologists." Now, it sounds like a sleeping mattress or something. The name didn't resonate with me, but the concept did because what they're doing is they're balancing the whole body and they're stabilizing the feet with inserts and insoles and orthotics, and which I did, and I got better at. But in getting better at it, I was resolving all these other issues that my patients were having. And I built a huge, huge practice. I was busy from sunrise to sunset. And it was interesting that I would leave the office at 5 or 6 in the evening, and I was never tired. I just felt, I have energies. Oh, yeah. And you always looked forward to Monday morning, looking forward to the going to the office. Didn't used to be that way. I like my profession. I like podiatry. I liked doing foot surgery, but it was stressful. And it was mostly gratifying. Once in a while was very stressful. But with the Bowen mixed into the group, I hardly ever did surgeries that I didn't really want to. Before, I used to do surgery because I had to, and I thought I needed to. But then the Bowen, and I incorporated that into my practice. I just didn't need to do as many surgical procedures on as many patients as I used to. Matter of fact, my surgical cases went from about 8 to 10 a week down to 5 or 6 when I started doing. After I did Bowen for a few months, I noticed my surgical schedule was tapering off. I was going, wow, I'm not doing as many foot surgeries. And but I was financially doing better, and I was emotionally doing better because I was under the stress of practicing medicine. And but I still practice, traditional medicine. I still do the surgery. I still did cortisone injections. Hardly ever had to, but when I did, I did. But prescribed fewer drugs and prescribed physical therapy, and I still referred to chiropractors and acupuncturists and other practitioners in the natural health field, which I always did, even before I learned Bowen. I think I was open minded to the topic because I've always referred to those chiropractors and acupuncturists and flexologists. And I knew that I couldn't solve every problem for every person that I treated. I referred a lot of people out. And so it was a real eye opener for me. But what happened is that patients would come back with these responses to the treatment and tell me what happened. And I said, wonder what that was. Like this one guy had at midnight every night, he woke up after the second week. I gave him 2 Bowens a week apart. And after the second week, he woke up at midnight with ants crawling in his ankle, his itching and tingling, and kept him awake for a couple of hours. The reason he had it in his ankle because he had fractured his ankle 14 years before when he was 16 years old. And it was like a club foot. It had traumatic arthritis, and it was stiff and rigid and had very little mobility. And his leg and back hurt. So I gave him the Bowen therapy for the leg and the back. And I was just first starting out. This is probably the second or third month that I was doing Bowen back in 1995. And so he came back 2 years later with somebody. He brought somebody for a treatment. And I said, well, you never came back for your follow-ups. And he said, well, I didn't think it worked. But after it got up that morning, after the ants were calling on my ankle, I had a little more mobility and range of motion, and it didn't hurt so much. And he says about a month later, about midnight, I woke up and it was ants crawling and itching in the ankle again for about 2 hours. And I looked back after the fact and I said, yeah, that's the liver meridian, 1 o'clock, about 12 o'clock, 1 o'clock in the morning. And he is a drinker. So I don't know if that had anything to do with it, but he, uh, he came, when he came back that 2 years later, he said he was 95% pain-free, range of motion is normal. He could climb ladders. He could ride a bike. He could do everything he wanted to do that he previously couldn't do. It took 14 months, itching every 30 days. It was like clockwork. Every 30 nights, his ankle would itch. Less and less as the months went by. And so I was, what's the itching? And I just thought, that's electrical currents. This is microcurrents. It's got to be. Or the nerves reconnecting, or well, I researched the literature, and I was reading Becker's book on the body electric, and I'm reading Gerber's book on vibrational medicine, and I'm learning about meridians and meridian systems and electrical piezoelectricity and direct currents in the fascia and all da. I said, we've got this circadian rhythm, we've got a biorhythm. Women have a menstrual cycle, and we have a cycle every 30 days. So I used to have a bad day about every 30 days, but I don't have them anymore. I got over that. But so he was going through this cycle, and it was 1 month for every year post injury. He was injured 14 years prior to my Bowen treatments, and it took 14 months of itching at his ankle to all resolve. But it did resolve. So those kinds of stories trickled in every week or two or three, and I studied the literature, and I looked up the case studies, and whatever I could get my hands on to try and figure out why this is happening and what's going on. And I learned a lot in doing so. So I put that into my manual, my book, and I call it the missing chapters from the Western medicine books: the piezoelectricity, direct currents, the fascia, the meridian system, and looking outside the box. The other thing we tend to do, myself included, as a foot specialist, always patients came in with a foot. I'm looking at the foot. I didn't look at the pelvis. I didn't look at the shoulders. I didn't like, well, once in a while I see somebody's crooked. So maybe you're crooked, but I didn't have anything. I couldn't do anything about it. And if I referred them to a chiropractor, usually he or she couldn't either. And so the patient stays crooked. And then I just learned how to straighten them out, but not me. I can't wear orthotics. If I put in anything in my shoe, my foot hurts so bad. I can't stand the pressure under my arch. So I'm just living with it. I understand why I've got it and what I've got, but I'm not going to do anything about it. But so I sailed through about 14 years of podiatry practice working on those kinds of patients. And it was really cool. I used to dread patients who would come in with a shopping bag with arch supports, insoles, shoes, medical records. They've had surgical procedures. They had cortisone injections in their feet, and now they want to try me. What am I going to do? In years past, before the Bowen, I didn't have much to offer those people, and I kind of I treat them and I do the best I could, but I usually strike out. And when I started doing my process I learned how to play adhesive tape to hold the arch up. Number one, I learned that before Bowen. Then I learned Bowen and added that to the process, and I ended up learning some craniosacral therapy and some other modalities that I started mixing into the straightening out package to get the posture realigned. And those foot pain patients that came in with their bag full of arch supports would coast out of my office in about 2 or 3 weeks, happy campers. Wow, this is great. I'd reform the orthotic because it didn't fit the foot. When I taped the foot with adhesive tape, you could see that there's a space between the orthotic and the foot. So I would reform the orthotic so it fit like the tape was holding, and they did fine. And I said, I'm the foot pain specialist now. I'm not just a specialist who treats foot pain. I'm the foot pain specialist. And interestingly, I started seeing that on the schedule. Patients were starting to schedule for foot pain. I used to just schedule for bunions and plantar fasciitis and ingrown nails and warts and hammer toes, but I never saw these specifically coming in for an appointment on an initial visit for foot pain. And I didn't tell my staff that I was the foot pain specialist. This is something I just thought, yeah, I'm a foot pain specialist. So all of a sudden started popping up on the schedule, and that's one of my things about manifesting when I get into the manifesting materializing your dreams and your desires. That's one of the things I do. And I can make that happen. I've made it happen in a lot of different instances in my practice over the years, especially was trying to get busier and more successful when I was younger. And I learned that if I wanted something and I thought about it hard enough and often enough, it would come to fruition because the law of attraction, it does work. Like the law of gravity works. If you jump off the roof, you're gonna all the way around. And if you think about something hard enough and often enough, it'll attract to you. And so I became the foot pain specialist because of Bowen. And I didn't even know about McLaughlin's scar technique back then. Today, I said, if I knew then what I know now, I could have helped even more people because so many people have injuries, fractures, and old dislocations and sprains and strains that healed fine.
I really want to drill a little bit further into talking about how scar adhesion and other kind of tissue injury in the feet and the ankles, which I guess even from your own story, your own childhood injury, how untreated or poorly treated injuries done in childhood then become the catalyst for changes coming further on down the line.
For sure. And then not only does it restrict motion and cause physical structural changes, it affects function, structure and function. And one of the things that Tom Bowen and osteopathy emphasizes is structure and function and figuring it out and sorting it all out and figuring it. So that not only does the scar tissue restrict motion, but it restricts the flow of the meridian system. And when the meridian systems gets awakened, it will tingle or itch or burn, or different sensations will be perceived by the person, the patient, different people, different times, different places. But when the the system is awakened and stimulated and to go and flow and percolate like it should, some people can feel it. And so as you block the scar tissue blocks the meridians as well as the lymphatics and the blood flow. So it's huge to release the scar tissue in any old injury site, because the problems that result remote from the injury is frequent. So I learned about that. I learned about the emotional holdings that people have um, from the trauma. It's the other thing that scar holds is to remember the memory of the incidents that caused the scar, the emotional whatever state with the patient or the person was in at the time that they um, experienced the scar happening, which gets into a whole another tunnel called the subconscious, with manifesting and with belief systems and the mind and the placebo effect and all of those things that are centered around the subconscious, the subliminal. It's a fascinating. The body, mind, soul is a fascinating piece of work. And the connections. I guess it's the sum total of my studies and my not conclusions, because it's not over. I'm still learning every day. But we got four wheels in the car. We got a physical wheel, we got an emotional wheel, we got a mental wheel, and we got a spiritual wheel. And all four of those wheels got to be turning in sync with one another so that the car can move freely forward. And if the tires are, if the wheels are out of balance or the wheels are out of air, or one of the wheels isn't carrying its load, it's going to affect the whole car. It's going to affect the whole movement. And so when we're talking about healing and wellness and helping people, ideally we should be helping is all four of those areas, and it delves into the past and present and future, other dimensions besides just like right here, right now. But right here, right now is important. But I won't get into that. But it's opened up my eyes and ears to all kinds of modalities and different treatments and philosophy of life and healing. And I don't know what else to say about it.
Well, I'm curious as well, because one of the things you said a little while ago was you were talking about how important issues around the feet could be in terms of problems occurring higher up the body, unless the problem is upstairs. And I'm guessing by upstairs you're talking about kind of TMJ and neck stuff. Is that right?
Oh, sure. Yeah.
So tell me a little bit more about how you would see that kind of presenting in clinic.
Now, I will admit I'm not real clear on how the TMJ affects the feet, but they must because the feet affects the TMJ. Jana Travell, in her book, the Trigger Manuals, Myofascial Therapy books, in volume 1, she talks about perpetuating factors for trigger points and points in the body that myofascial dysfunctions. And she talks about a study they did. She didn't say where the study was done or what they did in the study, but they did say that they stabilized the imbalance of feet in a number of people, and they found the incisal opening of the jaw increased 20 to 30% instantly.
Wow.
Okay, so if you balance the feet and the jaw improves, it's got to be if you balance the jaw that feet are going to, something is because it goes both directions. And so, but I don't know what the causative factors are from the jaw being out to the feet, but I do know if the neck and the shoulders are imbalanced and tight on one side, it's going to affect the pelvic tilt, and the pelvic tilt affects bunions, or the feet, and it contributes to bunions and pronation and leg length. And interestingly, the shorter of the two legs will supinate to elongate and raise the leg up, and the short leg side, the long leg side will pronate so that the leg would turn or rotate now will so that the patient will always walk with a list to this side, or like me, it's always to this side because the right ankle is supinating. So I said the neck, of course, is connected to the trapezius, to the trunk, to the pelvic girdle. And so if something is going on up above, it's going to affect down below. Interestingly, in the original Bowen notes that I got from Bowtech, there was a troubleshooting guide in the very last few pages. And Tom said, that if you're treating the shoulder and you're not having any results, check the knee. And if you're working on the knee and you're not having any results, check the shoulder. And so he knew that I didn't go into the TMJ and the ankle and all those other parts, but the shoulder knee jumped out at me because about a week before I had attended a seminar that they were demonstrating an electromyography machine, and they were selling them. I didn't want to buy them because it was like $20,000. And I said, "What am I going to do with that?" It'd be nice to see people's muscles contract when I'm doing things, but I'm not sure what the benefit is going to be for $20,000. I liked it not to buy one, but they demonstrated what happened. The teacher hooked up two electrodes to the hamstrings, one on each head of the hamstrings. And then he hooked three electrodes to the deltoid. And he said to the subject, he says, "Okay, on the count of three, raise your arm." And he's going, 1, 2, 3. The guy raises his arm and he freezes the monitor because the machine's like the EMG machine was hooked up to a TV monitor. He froze the screen, and you could see it's like an electrocardiogram. You could see two blips, 1, 2, and then there was a straight line, and then there's three blips. And he says, "Okay, see these two blips? Those are the two heads of the hamstrings firing off, and that strip was blank." He says, "That's 5 milliseconds." He says, "The hamstrings are firing off 5 milliseconds before those three heads of the deltoid are firing." So the body mind knows that you're going to lift your arm up. And he says, what do you think the hamstrings fires off? Everybody's going, oh. And he's because you're going to throw your center of gravity forward. You're going to. So your body mind, before you even make a move, knows you're going to make a move. That's scary.
I find that pretty exciting, really. I love the fact that there's such internal coordination in the body that it's seeing everything ahead of the actual action itself.
Yes, and so and if barnyard logic would tell you that if that's happening with the shoulder and the knee, it's got to be happening with the TMJ and the ankle, or it's happening with the neck and the pelvic girdle or other areas of the body. Like the Lovett brothers said, that cervical and lumbar were in conduction, when one moves, the other moves. And so, but it's interesting that the one part will move before to compensate for the what's going to happen. So the subconscious is amazing, and that gets into emotional stuff. It gets into food allergies. It gets into pain holdings because a lot of people. I used to get my panties in a wad. Couldn't get patients pain relief, but now I know don't sweat it because patients have past life stuff. They have ancestral stuff. They have emotional stuff. They have mental stuff. They have spiritual stuff. They have incorrectable things that are beyond my control. Somebody could help them, but not me, because I just don't have all those tools to do all of those things. And, there's not time of the day to do it. So with the emotional holding in a hip that's being abused physically and sexually, or that is held in a C-section scar, whatever, dislocated injury, shoulder or a sprained ankle. I had a lady with a sprained ankle. She's been inhibited from moving forward and afraid of failure most of her adult life because she sprained her ankle in college when she was trying to for cheerleading. And she was afraid she was going to injure herself before she injured herself. So the night before, she was in, what if I screw up and I get in? And sure enough, she screwed up and she sprained her ankle. And from that point forward, she was always emotionally a little stuck. And when I intuitively did McLaughlin's scar release on her ankle one day, and she was driving home and she had a tremendously huge emotional release driving her car, stopped at a stoplight, which lasted for about, you said, a couple hours. And then after the emotional clearing took place, and then she's like a new person. She's not afraid to move forward anymore. She's ready. And that reminds me of my first week I was doing Bowen Therapy. A guy released some stuff for me. His extensor hallucis longus muscle in a leg. And after I popped the muscle loose, with a Bowen move, and I left the room. And I came back, and he was curled up on the table, all in a fetal position. He's cold and clammy. And I said, "Oh, I took his pulse, and his pulse was warm. I was going to take his blood pressure." And he said, "Dave, you don't have to take my blood pressure. I'm okay. He says, can I get a blanket? I'm kind of cold." And I said, "Yeah, sure." So he got him a blanket, and he warmed up. And I came back in the room 5 minutes later, and he's sitting on the edge of the table. And he says, "I think I'm going to go home. I'm kind of tired. I'm going to go take a nap. When I see you again?" I said, come back in a week." So he came back in a week, and he said, "I don't know what you did. You changed my life." I said, "What?" He said, "You changed my life." He says, I just quit my job. I'm going to Costa Rica, open a restaurant, something I always wanted to do, but something was holding me back. That's what that was in the leg. That something was holding him back in moving forward. The big toe, he had an arthritic big toe. He can, he lost of motion, and it was crepitus. It grated and grinded, and it was red and swollen, and it was painful. And it was almost perfectly normal after releasing that extensor hallucis longus and lower leg. That was the very Friday following the seminar that I took for Milton. And I said, it blew me away. So, so the emotional stuff that will hold you back in life, this emotional stuff that'll perpetuate a pain, and we can treat the pain till the cows come home, and it's not going to get any better because the emotional problems still.
Yeah. I mean, I love that. When you were talking about that, I was kind of remembering back as well. When I was a youth back in the days, I used to do a lot of skateboarding. And it's only very recently I've kind of re-examined some of what was going on for me back then as well. But very aware at that time, even as a teenager, that in my mind, if I was going to do a trick on that skateboard and I didn't see myself having a successful outcome on it, I wouldn't have a successful outcome on it. And I spent a lot of time with my left foot forward on a board, head and body slightly rotated, The amount of times I felt on my right glute and right sacroiliac over kind of 10, 12 years, it was really interesting as a pattern in my body. And it suddenly helped me realize why I used to get so many problems with my lower back down that right side. And I'd never put the two and two together before. So it's incredible how much it can kind of feed into how our bodies are, how our minds are, and so on.
Yeah, it gets to one of the tricks to manifesting or making things materialize, your dreams come true, is you have to dream and focus on the results and the solution to the problem, not the problem to the problem. Don't keep dwelling on the problem because it's just going to perpetuate the problem. You got to focus on the solution, or you got to focus on the result, the end result, which is what you want, not focusing on what you don't want. If you focus on what you don't want, that's what you get, because the law of attraction works that way. And it's just the way it is. And so, yeah, if you think if you flat tires, you're going to be late to the airport. Oh gosh, you'll get a flat tire, or you'll have a dead battery, or something happen. We self sabotage ourselves, and it's important to visualize and emotionalize and internalize the outcome of the outcome that you want. But that's a whole other
Yeah, I just
subject.
don't think people realize the power of language as well. They don't necessarily think about how language is a directing tool, and so it takes us towards whatever it is that we're kind of focusing on within that language. To tell somebody to think of a flower, they can think of a flower, but tell somebody not to think of a butterfly, and they're still going to think about a butterfly. Right? So
Mm-hmm.
it's always interesting to watch the way that language directs us and moves us through the world, how we navigate with it.
And also language. No, language is energy. Language, the spoken word is creating energy. The thought is creating energy. Writing out and writing is energy. All these things produce energy that's going into the law of attraction world, cause and effect, and law of attraction. The eighth law of the universe is that all energy is in constant flux, and we have the power. We have the power to change the flux of the energy. We can change energy by our thought, our acts.
We absolutely do.
Okay. You were going to ask another question. of,
So I'm kind of curious a bit more about feet. And, you're talking about these relationships between belief and language and functionality. So obviously, as a podiatrist, seeing a lot of bunions, a lot of hammer toes, and then being able to, with the Bowen technique and the MSTR, have techniques for being able to shift that. But I'm kind of curious what else you learned within that, and once you move from being that kind of conventional podiatrist into being the holistic podiatrist, how you started to see changes in what was going on with feet and then within people's lives.
well, from a physical standpoint, a structural standpoint, when I would do my physical emotional releases for the bunions or the hammer toes for the plantar fasciitis, the pain would go away. Sometimes it didn't. Sometimes we had to do other things. And other things would be like craniosacral therapy or Nambudirpad's allergy elimination technique. And I didn't do a lot of that for feet, but I did a lot of that for other issues associated with it. Most patients came to me with foot problems, and then we evolve into other realms of their issues. But quite a few people came in with headaches or TMJ problems or frozen shoulders and carpal tunnels. But I'm dancing around the question because I'm not sure. If whenever I got stuck, I'd go to a little like a checklist. This is before McLaughlin's SCAR technique, because that opened up a whole another broadened my horizons a lot. But I had a little checklist. Is it emotional or is it an allergy? Is it a drug interaction or a drug side effect? Because a lot of times people are taking drugs. I would not be judgmental, but I would try and maybe it's emotional, or maybe it's work related, or maybe it's a secondary gain. They're getting sympathy there's some people thrive on their illness. So their adrenaline gets boosted when they talk about it. They like to talk about their stuff. So they don't want to get rid of their stuff because they get to talk about it. And so just be able to spot those people and not get upset when I couldn't help them, because probably they didn't want to be helped. But I sense that a lot of people have symptoms not in their feet so much with allergies, but a lot of symptoms in the general system come about from allergies or sensitivities, that get probably better word, a mind-body connector to a substance or a color or a people, place, or thing. And I had a lady that I was treating for plantar fasciitis, and she was also having headaches, and she went to the naturopath friend of mine. We cross-referred a lot, and a naturopath found that she was allergic or sensitive to the color orange. And when she switched her safety vest, she worked for the state of California in the Department of Highways. And so she had to wear a safety vest with bright color. It was very orange. And she hated the color orange. And she tested positive to orange. And so she switched to chartreuse, and her headaches and her plantar fasciitis went away. That's all it
Brilliant.
did. That's all day. And my same patient, the same friend of mine, Jean Slater, she's a wonderful lady. She teaches dowsing, which is a pendulum work. And she wrote a book called Hiring the Heavens. And we also shared a patient. The patient was having back pain after childbirth. And it turns out that she had a caudal in anesthetic, and they were having trouble getting the caudal to take effect, and they jabbed her with a needle a whole bunch of times. But finally, about 15 or 20 minutes later, they got it. So she was numb and she's comfortable. But the trauma for the needle apparently set up a mind-body connection to stainless steel. And so when my friend Jean tested her, she says, "You're sensitive to stainless steel." And she said, no earrings and no rings. And do you have any piercings on your tongue or anything? And she says, "Yeah, I've got one on my belly button." She said, "A stainless steel belly button ring." And so she took it out, back pain went away like that. So you wonder how many people are sensitive to stainless steel from needles and scalpels and surgical implements and things, and how many people are allergic and sensitive to foods and substances, colors. The sky's the limit. It's unlimited. What those have to do to the feet, sometimes they do, but sometimes they don't. I just figured that the more bases I could cover, the better chances I had of balancing those four systems, the four wheels. I couldn't do anything about spiritual stuff for people. I'm not a minister, but I could refer them to a minister if they need to. But anyway, I'm not sure if that answers your question or not.
Yeah, thank you. I mean, it does speak nicely as well to the whole concepts that sit behind vibrational medicine as a nature, in that everything has a frequency, and those frequencies are either sympathetic and in resonance with us, or they're unsympathetic and dissonant with us. So they're either adding value in, or they're costing us in terms of how that overall harmony within the body is in state. And I guess with Bowen technique, I always see it a little bit like we're playing the strings of the body and just looking at how in tune and how harmonious those physical aspects in the body are. But with all of those skills that you've got with Bowen, with the craniosacral, MSTR, the fascia release work, the psychological clearing, when you see people these days, how are you kind of assessing and approaching how to proceed with them?
Well, most of my patients come to me either with a foot problem or a pain, and I meet them where they're at and go from there. And once I get a little comfortable, we resonate. We have a little chit chat, a little talk while I'm doing the Bowen before, of course, before and then during and after. Suspect I should bring up the subject of an emotional problem or a food allergy problem or something else. I'll drop a hint along those lines and see what kind of a conversation develops as a result of that, and go from there. So it varies it varies from patient to patient as to which track we go. Yeah.
What do
I
you
have
think is the hardest thing for your patients to grasp? What do you find is the most challenging thing that you are trying to convey to them that they could benefit from understanding?
probably the mental and spiritual part of life that our mind and how we think about our our problems and our issues and the solutions to them and how we're going to respond and react to them. And I, that's the hardest topic to discuss with the most of the people. A few people are amenable or excited to go there, but most of them we talk about a little bit. We don't go any further. The emotional, a lot of people are concerned about the emotional part, and I do quite a bit for them. We also found that if the person writes down on a piece of paper what they're emotionally upset with, what the resentment is about, or the fear or the anger is about, and they hold them in their hand while I do a Bowen session, or they tape it on their belly button while I do a Bowen session, that information transcends through the into the system, into the mind body, and sometimes the awakening occurs. So sometimes a reversal will take place to clear that emotional thing and remove the blockage for that the emotional is the emotion is causing, and subsequently the pain. But most people come to me for pain, and when their pain is in their foot, always ask them if they have any problems anywhere else in the body. When they have pain somewhere else in the body, like the back or the neck, just ask them about their feet. And I always look at their feet because I'm tuning into those systems consciously and overtly, and then intuitively and subconsciously, I'm tuning into the spiritual, mental, and emotional stuff if I can, and then talk about those things if I can, and if they want to talk about them, and get them whatever I can do, or can send them to somebody that might be able to help them. A naturopath, a homeopath, a free foot reflexologist, a hypnotherapist, some other practitioner that maybe can do something that for them that I can't do. So I do. That's the way I usually approach those people. And I was going to say, I did recall one thing about the foot and the rest of the body. And I had a lady with a lump on her arch, a fibroma. And she said that the lump didn't really hurt, but she wanted to know what it was. And she was favoring it subconsciously. She said, I think I'm favoring it. I'm altering my walking, and it's making my hip and my back hurt. And I said, well, she said, can you do anything for my back and my hip? And I said, well, I'm a foot doctor. I don't do that kind of work. But I said, I'm learning this new technique. And this is about 3 months into Bowen. This is when I was going in, I took the bait. I was swallowing the hook, right? I get the guy with the emotional thing. Other patients were coming back saying, you would believe what happened. Another was says, oh, you changed my life. So this one comes in and she's got this lump. And I said, okay, I'll do a therapy that I'm practicing if I can practice on you. So I gave her a full body session, the sequence I learned from Milton. And she got up the table and she said, oh, that feels good. Yeah. I said, can I come back in a week? And I said, yeah, I'll check your foot. Oh, I taped her foot with adhesive tape to take the strain off the plantar fascia, because that sometimes reduces those fibromas. I don't know how, but it does. And so she came back in a week and she said, "You going to give me another one of those treatments?" And I said, "Yeah, we got you the schedule for that." She said, "Oh, good." She said, my neck feels wonderful. Yeah. Oh, look at my foot. So the look of the foot. The first week is about the size of an almond. It was this big. And then she came back the second week and it's about this, but like a pea. And she said, I took the tape off that night after you put it on because it was too restricting and it was tight. I didn't like it. And she said, I hope that's okay with you. And I said, that's no problem. And so then she showed her foot. And so I gave her another Bowen. She came back the third week for another Bowen and check her foot. And her foot now, the lump was a grain of rice. You could barely feel it. And she says, and I said, when I was doing the Bowen session, I did the pelvis procedure. And I was going to leave her room. And she said, wait, don't leave the room. She said, I forgot to ask you last week, is there any connection with the lump on my foot and my stomach? And I said, I don't think so. Why? She says, well, that first week when you did that on my pelvic area, she's like, I feel like a gush of worms crawling on my stomach. And I was kind of nauseous and queasy all day after the session. And then I got home that night and my gallbladder and hiatal hernia pain was disappeared. She said, whatever you did, fix it. And so then I looked at her foot and it was about like a grain of rice. And so I looked on the foot reflexology chart, which was my first instinct. And sure enough, it was kind of on the liver area. So that about 6 months or a year later, I'm studying the acupuncture meridians. And I said, oh, yeah, what meridians go through the inguinal canal and the liver, spleen, stomach, kidney. I said, she had a block in that tissue that's blocking the energy flow. When I released the block, the energy flowed into her stomach, healed, got it better on it. So yeah, and foot problem's gone, stomach issues gone, everything's gone, and she's a happy camper. And I didn't even hardly treat her foot. So I had lots and lots of those, and over the years, and it's very rewarding to be able to do that. One of the hardest things I ever did was say goodbye to podiatry and I just still practice a little bit under the radar. I still tape some feet and adjust some orthotics and do a little remedial care and sidewalk consultations for people. But I really miss the engagement of active podiatry and foot care. I had to quit too much with insurance companies and corporate medicine and all that stuff. That took the fun out of it. And I was just an aside. I've been to 4 podiatrists now in North Carolina, trying to find because I am having a hard time with my feet, and not a one of them enjoy what they're doing. They're just going through emotions, just good, but they're all working for a corporation. And I like that the happiness and the joy and the satisfaction I got from my practice as a sole proprietor, as a marching of my own tune. And insurance is fine because it covered some things, but that didn't cover others, and those didn't bother anybody. It did influence what I did. For some people, they couldn't afford a surgical procedure, so I had to devise other techniques to get them happy and make them comfortable. So it was good because it taught me to be creative. But I just look at the medical profession in general in the United States. And my family doctor, the doctors they're not having fun. And there's always the whole saying, if you're doing something, you're not having fun and you're not making a profit, what are you doing for?
It sounds a little bit like we could do with finding you another version of yourself so you can go and get your Bowen and your podiatry and your MSTR work to give you that little bit of extra boost where you are. But I'm kind of curious. We've been talking for over an hour now, and we're kind of coming towards the end of our interview. So I'm kind of curious as to what you think as Bowen practitioners we should be looking at more and doing more of that would improve what we're doing even further.
Feet and scars. Understand the foot connection and understand feet, emotions, and scars. Get good at those 3 subjects. And there's always the saying, you study a subject for 1 hour a day, in a year you'll be an expert. So you take those 3 subjects, and I don't think I'd spend the whole year on the feet, but I'd spend some part of the day learning something about the feet, the foot connection. I'd spend some part of the day learning about the emotions, the emotional connection, and then I'd spend some time working on scars and expanding your thinking about scars. Where a concussion is a scar. scar of the brain, but it's also scar of the soft tissue. Bumps and falling your tailbone. That's Corio's scar. Think outside the box. Start thinking about the possibilities of, what are the possibilities? But I did study those three subjects: emotional scars and the foot connection, and the emotional part gets into the food allergies and the substance abuse and cravings, and it goes into all kinds of things. The subconscious dreams and fears. I was afraid of heights all my life. The fear came from the nursery rhyme Rockabye Baby. I went through an emotional clearing with a practitioner, and when I got finished with my emotional release, I said Rockabye Baby to the practitioner. And I didn't think about it. And about 6 months later, he said, I don't have nightmares about high places anymore. I'm not afraid of heights anymore. I'm going to rockabye baby. That's fiction. That's not real. My subconscious got programmed by my grandmother and my mother singing that little ditty at bedtime to a 5-year-old or 4-year-old. I was conditioned to believe that heights are dangerous and I'm going to fall and whatever went through my mind. We got all this kind of stuff in us.
We have indeed.
And so we have the same thing with foods and cravings and allergies and sensitivities to colors and people, places, things, the subconscious. That's another thing I study probably an hour a day is the subconscious. I'm totally curious of it. Where is it? It's everywhere. I think the subconscious I think it's in the heart. I think it's in the gut. I think it's in the fascia. It's in the cell membrane. The cells are computer chips. Bruce Lipton found that out. So anyway, I don't know if that answers your question.
Mitchel, thank you so much. It's been an absolute pleasure spending time with you. Really interesting to listen to you, listen about your work. And also a big thank you to everyone who's been listening in today as well. Your time and attention is really appreciated. And just to help us continue in our work, the BTPA, of helping to spread the word of Bowen, please hit the like and subscribe buttons down on the bottom there, share this out there. And last thing, Mitchel, as well, if people want to learn more about you and your work, where's the best place for us to send them to? And we can stick a link of that down in the description below.
www.bowen4 and I'm just embarking on a project. I'm going to update my YouTube video channel. My channel, as a matter of fact, I'm starting tomorrow with a lady that does videos for YouTube. And so I'm going to be putting all my materials on YouTube before I put them in a book.
Fabulous. We'll look forward to seeing all of that.
I'll keep you posted through Facebook or
yeah, absolutely. And we'll make sure that as that YouTube information becomes available, we'll share that out through our network as well, because 30 years worth of experience, a wealth of experience in Bowen technique, it's something that is valuable to be shared. So thank you so much for your time, Mitchel. It's been a real pleasure speaking to you today.
Thank you for inviting him in. Have a great day. Thanks.
Yeah, thank you. You too.